Hi, McKay. My name is Corey Sicky, and I'm responding to your discussion board regarding the ACA Code of Ethics, and in particular tests and assessments section for that code. And I thank you very much for the very thorough job that you did on reviewing that, and I appreciate the 3 points that you pointed out. Your first point was regarding clinicians and their responsibility, which of course the code is so focused on the responsibility of the counselors and clinicians to, as you said, make sure that the clients come first and that we're safeguarding the client's welfare and not causing harm. Um, and it made me reflect upon Luke 12:48, where it says, "Everyone to whom much was given, much will be required." And as students, master students at this level, and getting prepared to become counselors, we have so much information and knowledge that we've gained. And it is so important that to remember that we've been given all of this knowledge and all of this information, and it's such a huge responsibility to make sure that we are treating our clients respectfully and doing our very best to prevent any kind of harm whatsoever. And that's it's a requirement, for us as counselors to make sure that our clients' welfare is of utmost importance. And also, the code in section E1B states reasonable steps to prevent others from misusing information, and that we're responsible for not misusing assessment information and the interpretations ourselves. So again, going back to that client welfare, that we're responsible to make sure that the test information is used properly, whether it's by us or whether by another individual that we're giving that information to. So a huge responsibility. Um, and the point of historical and social prejudice, more importantly, misdiagnosis and the potential harm that has, that is huge. There's so much stigma in our world regarding certain diagnoses. I think of, for instance, the big ones like schizophrenia or bipolar, and there's a lot of stigma that is attached to those diagnoses. And anxiety, maybe depression, not so much, but some of the bigger ones, addiction is another one. So there is a lot of concern over the information that we let out there about our patients, or labeling or diagnosing them based on assessments. And again, the ACA Code of Ethics in E5D states, referring specifically to diagnosis, to refrain from making or reporting a diagnosis if we believe it will cause them harm. So I found that point very interesting. Like, if we believe that this diagnosis in some way is going to cause harm to our clients, we have the opportunity to withhold that diagnosis. So that was a very interesting point to me. Thank you so much, McKay, for your input, and thank you for your participation. Have a great day.